Do you happen to suffer from temporomandibular joint pain, muscle pain, or facial pain that you've been told or you believe is related to something occurring in your temporomandibular joint area? So one of the very simple techniques I want to show you using a product called Dycem, D-Y-C-E-M. You can get it at Dycem.com, D-Y-C-E-M.com, or I believe even Amazon sells it as well. So what I want to do is I just want to give you a little bit up close and personal view of what I believe we're doing at the joint level, but also very gently stretching these muscles. So what we're trying to achieve with this Dycem is, here is your temporomandibular joint. This is your condyle as it rests in the fossa. Due to the tacky nature of the Dycem and with very gentle hand pressure and then what I call like a little bit of a long axis distraction, you're going to be able to very nicely, now I'm exaggerating the amount of movement, but I just want you to have a visual, we'll be able to very gently distract that joint downward and or sometimes downward and slightly forward, which is just enough to reduce any pressure and compression that's occurring up into the joint or where this condyle is putting pressure on these very sensitive nerve and vascular structures. So I'm going to demonstrate now with the Dycem. So all you really need to do is take two small pieces that you can cut down. And again, like I said, it's very sticky and tacky, which is nice. You're going to apply it literally just to the sides of both of your cheeks like so. And then roughly, you don't have to be overly specific, but if you can visualize, my index finger is just slightly in front of my ear, and just below, my fingertips are just below your cheekbone, what we call the zygomatic arch. And all I'm really doing with the Dycem, because it is so sticky and tacky, is I'm just very gently applying an inward, right? So I'm very gently compressing the skin on my cheek here, inward, and then just using the weight of my arms, so I'm going to exaggerate, to pull down and maintain this position. 10, 15, 20 seconds. But I think for most patients, they find this incredibly relaxing. It's also very relieving if there is a lot of compression into the joint and you are suffering from joint pain. And then in addition to just very gently having the weight of your elbows and arms drop downward, you can also sort of direct a slightly forward movement with your hands and fingers, as though you were bringing that jawbone sort of down and slightly forward, and then just maintain that. In addition, this is when I will tell people to just relax their jaw, keep your mouth slightly open. You can, if you want, keep the tip of your tongue slightly up on the roof of your mouth, but that's not always necessary. And again, the whole concept is to decompress the joint, but I'm also getting a very nice, gentle myofascial stretch on one of the more prominent and involved muscles called the masseter.